Hello everyone. Today I would like to give you a little demonstration that could potentially save a life. Did you know, according to the CDC, injury is the leading cause of death in children ages 19 and younger? And according to a Stanford article, airway obstructive injury is the leading cause of death in infants under the age of 1. So wouldn't it be nice to know how to react if you came face to face with one of these injured children? That is what I plan on showing you today. My name is Samantha Shepard, and I've been a registered nurse for 6 years. Some of my certifications include neonatal resuscitation, advanced cardiac life support, and basic life support. Today I will be demonstrating the steps taken in performing infant cardiopulmonary resuscitation, or CPR. So if you ever find yourself in the presence of a child who has no pulse or is not breathing, you will know what to do. The first thing I'd like you to do is check your scene for safety. If you become injured because the scene is unsafe, you will be of no help to this child. At the same time, you are also looking for obvious signs of injury. The next thing you're going to do is call 911. If somebody is with you, send them to call for help immediately. If you are by yourself, then you will perform 2 minutes of resuscitation and then call 911. The next thing you're going to do is lower the infant to the ground and check for signs of responsiveness. To do this in an infant, you do not shake the baby. What you're going to do is you're going to flick the soles of their feet or the palms of their hands. And next, in terms of assessment and resuscitation, I would like you to think of the letters A, B, C. A is for airway, B is for breathing, and C is for CPR. To assess the infant's airway, what we're going to do is place our hand on the infant's forehead and a few fingers under their chin and slightly tilt their head back. This opens the child's airway. At the same time, we're looking for obvious signs of obstruction in the mouth. The next thing we're going to do is B for breathing. To check for breathing on an infant, what we're going to do is observe the child's chest for movement. And then we're going to place our face close to the child's mouth to feel for air movement on our cheek and to listen for sound. This should take a maximum of 10 seconds. So now that we've determined that our infant has no pulse and is not breathing, we're going to move on to C for CPR. To perform CPR in an infant, you're going to take 2 fingers and place them in the center of the infant's chest. You're going to use the nipple line as a guide. And you're going to place your fingers directly in the center of the chest, right below the infant's nipple line. Now you're going to want to push hard and fast. You're going to push at a depth of 1/2 to 1/3 of the child's chest depth. And you're going to do this at a rate of 100 to 120 compressions per minute. You're going to do 30 compressions to 2 breaths. When you perform breathing for an infant, you're going to place your mouth around their nose and their mouth to create a complete seal, and you're going to give them 2 breaths over 1 second. You're going to repeat this cycle until 30 compressions to 2 breaths, until emergency services arrive or until the child shows signs of life, such as breathing. According to the American Heart Association, effective bystander CPR, when performed immediately upon cardiac arrest, doubled or even tripled the chances of a person's survival. So now that you know that CPR is important in the event of a life-saving emergency, you can check with your local police stations and your local hospitals to see if CPR classes are available. Another great resource would be the internet. The American Heart Association and the American Red Cross are great resources for online CPR certifications. Thank you for taking the time to watch my video on infant cardiopulmonary resuscitation. Thank you.